Thank you, Your Excellency. A little. Oh, so as far as menstrual hygiene is concerned, menstrual hygiene management, what is this social? And then there's another word, change. So what is this social behavior that we want to change? Maybe we start with that. You will not feel shy.
I will not feel shy.
I will take pride.
I will take pride.
I will spread the word outside and inside the home.
I will spread the word outside and inside the home.
So help me God.
So help me God.
Bas, sasa ndo hajawahi kuwa on.
Here to discuss and talk about how we can mainstream the issue of menstrual hygiene management for our children, the girls, our mothers, our sisters, and this has been a major issue. You have heard about the issue of stigmatizing menstrual cycles, and we tend to think this is a biological phenomenon. It's a normal thing, and we have not been paying attention, and yet some of our girl child and even our mothers and sisters have been suffering discrimination and stigmatization of a biological process. So we are just looking at how we can build awareness from various stakeholders, from policymakers, service providers that are involved, and even the medical fraternity, and even the gender themselves, to mainstream them in, to know that this is a normal thing, and look at what service providers can give the private sector. You know, they have been getting sanitary pads that are disposable. Some of them may not be able to afford that. So we are looking at also those business entities that can come up with innovative ways to provide alternatives, like the reusable sanitary pads that may be cost effective and easy to use, especially also for girls in schools, or even people admitted in hospitals, or just career ladies who are going about their normal business. That there's various packages that they can use when they're undergoing the menstrual flow that may not interfere with their work. And we're also looking at the kind of environment that we're working in, that they should be friendly, yeah? In terms of sanitation, in terms of where they're able to change these sanitary pads wherever they are worked, either in workplaces or in schools, and how they're also disposed of, so that we are also controlling our environment. You know, health is devolved, and it is our responsibility as even county governments to do our work. But we are very grateful to our partners, USAID, who have come in to help us in some of those aspects, so that we are finding solutions to this problem that we have been having. Friendly, come up with budgets that support these menstrual health management systems. That's the reason that we are here. And you remember during the Lake Basin Summit meeting, and our CEO is here in Kisumu, I was given that responsibility to champion that cause, working with USAID and our other counties within the Lake Basin region. And because of that, that's why yesterday we were in Homa Bay, today we are here, and you're going to be seeing us also in other places as we have tried to address this particular issue on sanitation and menstrual health that you're going to be given. And I think even nationally and within the region, 65% of our women cannot afford these commercial disposable sanitary pads. And that's why we are saying we must come in with some form of intervention, both from the government and the private sector and other stakeholders, to see how do we come up with a sustainable solution to address that matter. Yeah, and even if you look at school absenteeism, you'll be able to get detail from the Secretariat, Communic. Even school absenteeism in this region, like even in Migori here, was almost 60% of the girls who are undergoing periods, they miss schools. And we are talking about missing schools for almost 3, 4, 5 days. Yeah, and that cannot be acceptable. And even the other lady folk, whatever activities that they are engaged in. And that is definitely affecting the productivity of this area. And these are things, when we come up with solutions, you can go about your business without any stigmatization or having pads that you can utilize without inconveniencing it. And of course also disposing them off in a proper manner once they have been used, or having a way to reuse them in a more hygienic manner once you have used what you have used and you need to change. So those are the kind of things that we are looking at. Said we are championing this. Other than just serving the people of Busia, I believe I've got a commitment to the people in the Lake Basin counties and Kenya in general. We must remember that we are Kenya. So this is something that we are doing in our counties, and even we are coming up with county-specific programs, and we want to see which county is going to be the champion in implementing menstrual hygiene management programs. So we will be even competing to see which county is achieving better statistics in terms of making sure that there is no absenteeism, there is no inconvenience, it is hygienic, you are providing services, and it will start by even looking at the budgets of the counties. What are you putting in to support even what our bilateral partners are trying to do with us? And that's why I said I was happy that even members of the county assembly, they're also here, and you had them talking about the budget making process. We are doing supplementaries now. How do we complement these, and how do we take over? Because partners should be the one complementing us, not the other way around. We should be the ones championing this. So you'll be seeing in the region that we'll want to compete. Busia may want to be like the one that has achieved the highest level of menstrual hygiene. And Migori here is saying they must be top. And I'm sure Kisumu will also be saying something. So we will come up with a system that we encourage. And more so, you also need to partner with us in terms of awareness. Yeah, we need this level of awareness so that we have that behavioral change for people to understand that this is just a biological phenomenon. It's part of life. Without it, there will be no life. You will not even be alive. You who is laughing at it, you will not even exist without that process. And that's the message we want to put across. It is a normal process, but let us also give them tools to utilize when they're undergoing that process.
We are very much keen in ensuring that all girls have access to information, and not just information, but they have access to the sanitary towels that they need. And to just affirm on what the governor has just spoke, we are looking forward to ensuring that girls do have access to quality menstrual product, and also we want the budgetary allocation to make sure that these products are affordable, because pads many times to those people who can afford it, they feel that it is just a normal conversation, but it's a luxury that many of our girls cannot afford. So through this initiative, we believe by come 2023-2024, we'll be having a change of narrative, not only on social norms and normalizing the period as a stigma-free, but also ensuring that these things are accessible to not only the girls, but also people who are working, like Mama Boga can easily access these pads, and also the entire community at large. And also looking at the sanitation. Do we have enough facilities in our schools that girls can easily walk in and wash or clean when they've stained their clothes without being stigmatized and go back to their classes? So these are the things that we are looking forward to work through during this entire implementation. About reusable pads is the fact that many villages or many communities do not have access to water. And we can say that if you take a reusable pad to Turkana, you will not be helping these girls, because by the end of the day, they will suffer the infections coming with the uncleaned reusable pads. And also, it is not just about giving pads to the girls. Can we make sure that the quality is really good, that does not affect their health or hygiene-wise by the end of the day? So when we talk about reusable pads, yes, reusable pads can work, but in which areas can they work? Those are the things that we need to look at in terms of geographical locations and how they are being used. So it's not a matter of giving out sanitary towels to girls, but it's a matter of checking the quality and the convenience of how they are going to use it. To the government is to ensure that we have access to quality, tax-free pads or menstrual hygiene products for all girls across the country.
Menstrual health hygiene management champion. And what I will beseech our county is to ensure that we have budgetary allocation for the access to these commodities. The menstrual hygiene management commodities the girls find it so difficult, even if they can access, but the affordability of the product is also in question. So currently I'm asking the governor if it is possible for him to allocate the entire budget of the county, about 10%. The 10% to be allocated for health, and to be specific, the 10%, the 5% of the 10% allocated from the health should be for the accessibility of the commodities, so that these girls are able to access the sanitary towels in schools. So when I talk about the access to sanitary towels in schools, it's not just merely availing the sanitary towels. It also goes hand in hand with the privacy of these girls. When they want to change these sanitary towels, are they secure? Are they private? Do they feel comfortable when they need to change the sanitary towels? And in the event that they're able to change the sanitary towels, do they get access to soap and water so that they're able to even clean their soiled hands? They're able to clean their soiled clothes? Can they walk publicly knowing that actually I'm soiled my clothes, but the entire public or even the people that are learning with me in school do not stigmatize me, and I do not feel ashamed, because this is a biological process that any other person, any other woman will have to go through. So even the sensitization of male champions in school will go a long way in ending the period shame, in ending the period stigmatization among girls, and as well as eradicating period poverty in our homes.